Yeah, everybody. Yeah.
All right. So, guys, welcome back. We're going to continue with the in-service. All right. One very important topic is the follow-up. Following up with your patient's care. We want to make sure that we follow up. This is stuff that does need to be reported and it does need to be documented to be compliant as well. The follow-up would include stuff like wounds, antibiotics. We need to make sure that we follow up with our patient. We find out if they're taking the 7-day regimen, if they're taking the 5-day regimen, how are they feeling? These are all things that need to be documented so we can go ahead and prove that they did take the antibiotics and they did get better. The only way we can find out is if we follow up. We have a bad habit, including me, I've done it before, to where we order the antibiotics, we don't ask anymore. We don't know if they've gotten better. We only see the patient every 2 weeks. We hope that they're taking it. We really don't know. This is why the follow-up is important. It's just a phone call away, a text away. I prefer a phone call, but a text away. So, sir, did you receive the antibiotics? Yes. Okay. Maybe 3 days later, it's a 2-minute call. How you feeling, sir? You feeling better? Yes. Okay. Remember, antibiotics, even if you're feeling better, you have to finish the whole regimen, all 7 days, sir. No quitting halfway. Yes. Okay. All right, sir. I'll call you on the 7th day. These are all the little steps that go a long way, and it's honestly required to make sure that that RQA is able to follow up and post this. We need to show results. Anytime we order antibiotics, we need to document results. It is for quality services. Sometimes the antibiotic that we provide, patient can have a tolerance to it. It might not work. Sometimes, for UTIs, certain patients respond better to one antibiotic than the next. And this way, we also get to know that for the next patient's UTI, we're not ordering this. This didn't work. The last time we ordered this and nitrofurantoin and it worked. So from now on, no more guessing game. We documented, we went, and we're ordering the nitro, right? Like I said, this is all based on documentation. We don't know if we don't follow up, and if we don't document it, it never happened. So this is why it's very important. We got to remember, guys, that the patient is really relying on us to make sure that we communicate with the doctor. It is a lot of responsibility. It is a lot of, extra step in care. But, we signed up for this. We're here. We're nurses. We're here to take care of the patient. We need to make sure that we follow up with them and also report to our team. I know some of us are per diem, and I get it, but we really appreciate it. Even if, just remind the staff, hey, don't forget, guys, we need to follow up. We can call the office maybe and can we follow up on the antibiotics? I've tried calling the patient. Like I said, you do have a supporting team, so just help us follow up because it is very important. Not only that, it makes the nurse, whenever you follow up with your patient, the patient feels that blanket of comfort and peace of mind. Wow, they care, they remembered. This is good, they're on top of it, The last thing we want is for the patient to say, yeah, I got it, 7, didn't do anything. I'm still coughing, I still got phlegm, I still got this. I don't know, I'm waiting for the nurse to come in on Tuesday. And that's not good, right? All right, let me see. Are you guys familiar with, maybe we could talk about consents really quick? All right, consents, right? Not everybody's going to do them, but it's good to know the basics of the consents, okay? So anytime the patient is about to start care, before we can even start care, we got to get their consent. We got to make sure that we have a signature, whether it's the patient or a family member that is a power of attorney or the husband, right? We need these signatures in order to be able to consent to care. There is a couple of signatures or initials that are required. The basic ones are, you can tell the patient, it's all on presentation. I've done this so long, I can have family members sign. They'll be talking to me and they're just signing away. You know, they don't even know what they're signing sometimes. And others are like, what is this? Let me read this. Let me read this. You want to give them a quick rundown. Look, in order for us to start care, we do need your consent. We do need your signatures to be able to start making moves on your behalf. We need your signature to make sure that we're able to order DME and start getting these supplies to your home. We need to be in charge of your hospice care in order for us to do anything. I want to help you, but I do need these signatures, right? Okay, so these signatures basically, what am I signing? Well, you are signing consents to allow us to provide medical care for your loved one or for yourself. You know, these consents include consent to let our Dr. High, our medical director, give orders and start providing this hospice care for you. There's also consents for taking pictures, to be able to provide and take a picture of a rash, a cut, something, and be able to send it to the doctor. I do need these consents. There's also a Privacy Act, a HIPAA. This states that we don't give your information to anyone who's not authorized to have it. Sir, I'm not going to sell your information. I'm not going to give it to a therapy company, a pharmacy, whoever. If they're not involved, then they're not getting the care. This also gives me permission to go ahead and ask for any history. Sir, you said you go to Loma Linda Hospital, then this signature allows me to get your history from there, so I know what your history was. You might not remember, but you did have a stroke 5 years ago. You might not remember, but you were taking this blood thinner before. You might not, we get all the information. You might not remember but you do have a mass that you forgot about but you do have a mass on your lung, whatever it is, right? This gives us permission to do that. Patient's rights. This also states all your rights are as a patient. Feel free to look it over. And we will give you copies of everything. The copies will be in the binder, or we have the option to scan them and send them to an email so they always have them. But these are very important. Another consent is it would be like if there's any advanced directives that we respect them, right? For the advanced directive worksheet, it basically states if you don't have advanced directives, we can have our social worker offer them and explain it to you, right? If you do have them, great, then we'll respect them. We need a copy of it. If you don't have them and you don't want them, it's okay. This will not stop your hospice care, but we do need to note it, right? It also asks if we received a copy of it. So we'll put a copy received, yes or no. If there is an advance directive or there is a power of attorney, we need to make sure we write the power of attorney's name, whether it's a daughter or whoever it is, a neighbor. But if they have it, we need to make sure that we write their name, their address. There is a slot there for it. And we also need proof. So we need to make sure that they send a copy, they scan it, or we can scan it there at bedside, of the power of attorney. This is just for legality purposes, obviously, right? And we need to make sure we have a copy of it. Once we have a copy of it, we can send it into Myra via Slack. She'll make sure that she posts on Hospice MD, so it's always there. Post. This is very important. How do you present the post? What is it for? It also depends on the patient's diagnosis. But for the most part, it's very sensitive because you're telling the patient, all right, this basically states what your wishes are if we come in and you have no pulse, no respirations. You're basically expired, sir. We do have two options. For hospice, if we're choosing hospice, the most desired option is DNR, which means do not resuscitate. Sir, with all due respect, you do have a hospice order. I know the hospitals and the doctors have tried everything they can to make sure that your health gets better. At this point, it's about comfort care and comfort measures, So if you have lung cancer, and some of them will require a very extensive explanation. They're like, no, bring me to life. Everything you can do to keep me alive. But this is where your nursing knowledge, this is where your communication skills all come into play. Look, sir, there's a reason that you are on hospice. It looks like you have terminal cancer. It looks like you have lung cancer with mets to the bone, with mets to the brain. Unfortunately, at this point, the doctors have tried chemotherapy and radiation therapy, and unfortunately, they feel like this is the best route. If I were, think about it this way, like your body's shutting down. What would be, why would you want us to, bring you basically back if your body's already shutting down? The cancer is very aggressive. It's very hard to explain, but you got to find the right words, because it all depends on culture, patient sensitivity, family members as well, because sometimes you're surrounded by daughters who are like, no, do everything you can to bring my mom back to life. She's not leaving us, right? It's like, man, mom has cancer, brain cancer. Even if I were to pump her heart and we bring her back, the cancer is very aggressive. The chances of her coming back is very slim to none. Plus, it's not going to change. The cancer is not going to be reversed. It's not going to make any difference, man. We should let her rest in peace. We don't want to bring her back to suffering. Plus, we don't know how long the patient has been without oxygen. Patients' organs are already damaged due to their disease progression, whatever it is, whether it's the heart, whether it's the lungs, whether it's the kidneys. These are all things that are already damaged. The lack of oxygen is only going to bring more damage to them. So I don't know if your family member has been without oxygen for 15 minutes, 20 minutes, and the brain as well. The brain takes every breath, the brain takes the most oxygen out of every breath, and then, the rest goes to the rest of the body. But the brain, I think it takes 80% of every breath that we take in order for it to give off the signals and have the body function properly, right? So if the brain hasn't had any oxygen for 15 minutes, even if I get that heart to pump, there's a good chance that the brain will be in a vegetable state and we cannot get the brain to go, which means you will not be able to communicate, which means you will need machines to tell you to breathe, which means you will need feeding tubes. And even then, there is no guarantee that the body will accept the feeding tubes. There's a good chance the body can reject the feeding tubes, which means now you have a hole in your abdomen with a chance of more infection, pain. You're unable to state that you have pain. You're unable to state that you need to be changed. It's just bad all the way around, but you got to find a way. You got to put your own stake on it, if that makes any sense. It's the basic info, but you got to find what's Janice's best way of explaining it. What's Veronica's best way of explaining it? This is how I explain it, and I play it by ear, obviously, but you also got to let them know that DNR is what's preferred when it comes to hospice. This is the whole reason they are on hospice. It's frowned upon to patients to be a full code and be on hospice. Medicare, Department of Health is going to say, wait a minute, why did you agree to be on hospice if you want to get revived? At the point of you joining hospice is because you're telling me you're very conscious of the fact that the disease progression is going to eventually, make you expire. So why would you want to be revived? Plus, it's frowned upon if patient continues to go to the hospital and their full code or their DNR. So we need to make sure that we explain to our patient what DNR is. Sir, DNR means no hospital. Everything they're going to do at the hospital, we can do here at home. This is why we create a small ER room for you. This is why we get oxygen concentrator. We provide oxygen, just like the ER. This is why we provide the comfort kit with all the major symptom medications like morphine for pain, same thing as the ER. We have stuff for anxiety, same as the ER. We have suppositories. Why do we have suppositories? Because there might be a point in time where you're unable to swallow, you're unable to talk. So we need to find a route to make sure that we get the medication into you, right? We have suppositories for pain, Tylenol and fever for pain, which is Tylenol for fever and pain. We have suppositories for constipation. We want to make sure that you're not constipated. The last thing we want you is unconscious and not be able to, you're backed up. So these are all the reasons that we have them. We have lorazepam for anxiety as well as shortness of breath. Same as morphine for severe pain. Oh, I'm scared of morphine. morphine. I heard, sir, this is the deal. We're trying to provide pain relief while our nurse gets there. We always start with the lowest dose of morphine, but I do want you to not be in pain while the nurse is on her way. So take a little bit of morphine, it's instructed on there. The nurse will guide you through it, and this comfort kit that you have at your bedside should never be opened unless you're instructed by a nurse or you're coached on the phone. So when the time comes and you do need the morphine, sir, there will be a nurse on the line instructing you. It's just to hold you down until our nurse gets there. If we need something else for pain, then great. If not, then, we did our job. There's also, I think I always have a hard time pronouncing this, but it's hyoscyamine. Is that how you say it, Rodney? Hyoscyamine or?
Hyoscine.
Hyoscine, I'm sorry. There it is.
Hyoscine.
Hyoscine, okay? This is for excessive secretions. Sometimes patient is open mouth breathing. Sometimes they got saliva coming down, and you give them the medication, and this will dry up their mouth a little bit. But at the same time, you're required to do some family education to where, yes, it will dry up the mouth because they won't be drooling, but at the same time, let me teach you how to do mouth care. We got oral swabs, we got mouth gel, we got mouthwash. We also got to keep the mouth moisturized so that we don't get blisters, we don't get dry mouth, the tongue start. You guys see it, and on top of that, we get a foul odor, and we can possibly get an infection. So a lot of it is education as well with this comfort kit. Every time we admit a patient, we have to order a comfort kit. These medications have to be in place because these will bring the quickest relief while we get a nurse out there. There's also Zofran for nausea and vomiting. And these will also help with preventing a PRN call. They can call you at 2 a.m. and say, hey sir, my dad's been vomiting, has been nauseous, he's been vomiting for the last 2 hours, we don't know what to do. Okay sir, tell you what, do me a favor, go to the refrigerator, grab the comfort kit. Got it. Okay, look inside, there's a medication called Zofran. Found it. There's one tab in there, sir, grab one tab. Put it under the patient's tongue. Okay? Done it. Okay, perfect. Medication's gonna take about 10 or 15 minutes to take effect. Give me a second, and then I will call you back. Or in the meantime, I'm gonna find a nurse to make the visit. In the meantime, I'll call you back in about 15 minutes. Let me know how you feel. Okay, so we'll call back in 15 minutes. Hey, sir, this is Ulysses with the Amici Hospice. Just following up on your dad's nausea and vomiting. How's it going? You know what, Ulysses? It's still going. It's really bad. Okay, sir, let's go ahead and administer one more. And the nurse is on the way. They'll be there within the hour. Okay, thank you very much, Ulysses. Or it could be like, you know what, Ulysses? It subsided. It actually worked. Okay, sir. Yeah, he's actually resting now. He's actually kind of looks like he's falling asleep. Great. This is exactly the effect that we wanted. So I'll tell you what, I'm going to hold the nurse visit and we'll follow up in the morning. Just give us a call back if you do need it again, and we'll send the nurse if needed. But I'm glad we were able to take care of your dad. I'm glad his nausea and vomiting has subsided, and this is what we're here for. Thank you, Ulysses. Have a good night. Have a good night. Right? This is what the comfort kit is for, to bring that quick, prompt symptom control and alleviate pain, nausea, whatever it is. Yeah, I mean, there's another point there. Basically, like I said, the follow-up. Let's make sure that we follow up to make sure that medications were delivered. Even for PRN call, guys, you give the order. You give the order to Ella. Ella will put the order in. Maybe just instruct the family. Hey, sir, do me a favor. Give me a call when the medication arrives, just so I can have peace of mind. Let me know that the medication did arrive. It should be there within 2 hours. But if it arrives sooner or it arrives later, or if it hasn't arrived, please reach out to me. Let me know, and I'll follow up. I'll get an ETA for you. All of these things, it's all quality care. Like I said, we're stressing quality here. We want to make sure that patients, family have peace of mind. This is the whole reason. Hospice is a very important branch of nursing. It's not for everybody. It's not for everybody. And this is not, unfortunately, this is not the type of job that you can leave at work. Sometimes they do call you because they're relying on you. They build that relationship with you, and they really want that TLC from you to let you know that, for you to let them know that everything's gonna be okay. All right, should we take a break? I think it's lunchtime, guys. Is that okay?
How many more are we?
I think we should be done, but one point that,